Good afternoon. I'm Congressman Kevin Brady here with Congressman Michael McCall, Congressman Pete Olson, and joined earlier by Congressman John Culberson, who had to leave. We met today with leaders of the Texas Medical Center here in Houston from virtually every medical discipline. And what became clear to me and what we wanted were their ideas from some of the leading minds in America on how they would improve healthcare. We went through nearly an hour and a half, almost 2-hour session, and what's become clear, if there is a message that unifies everyone, it is we do need healthcare reform, but it's important we not rush it through Congress, that we take a thoughtful approach that really does it right, both for covering uninsured America, for making healthcare more affordable, for finding ways to tie people's prevention to their healthcare premiums, and finding ways to make it more efficient, to line the patient and the doctor together. I have some more comments, but I'd like to start. Michael McCall's got another engagement. Congressman McCall.
Thank you. And just let me say what an honor it is to be here and to hear from the experts, because that is something that the Congress did not do before it passed its bill out of committee. We didn't hear from the experts. Today, we heard from the best experts in the world on healthcare. And what they told us was that don't destroy the best medical care system in the world, and that Canada and England are not the model. The United States has the best healthcare in the world. And the other thing we heard today was that the public option will destroy American medicine. And I think that's a loud and clear message from the best healthcare professionals that I view in the world that I'm going to take back to Washington, and I know my colleagues will as well. Thank you.
We're also joined by Congressman Pete Olson as well. Congressman.
Well, thank you all for coming in. Good afternoon. And I'd like to thank our Kevin Brady for putting this meeting together. And it was an opportunity to sit down and talk with, as my colleague Mike McCall mentioned, the experts in the world on the many, many different aspects of healthcare. And that's important for us to go back to Washington and have that information as we have a debate. And as my good friend Kevin Brady mentioned, that's the most important thing that came through this meeting, is the message, take your time. Take your time to get this right. It's too important for all of America. And to tell you, in all my town halls, the emotion that is behind this issue has been unprecedented in the 10 years I've been involved in the federal government. And so it was a great meeting, and I really appreciate Kevin and the personnel here at the Medical Center to sit down and chat with us to give us the real skin on how this proposed health care bill is going to affect American health care in the future.
Right. Well, Pete, just a final thought before we take questions is, my view is this massive government-run plan is really collapsing of its own weight. We ought to, after Labor Day, go back to the drawing board and really break down healthcare and take it step by step. Let's start by covering the truly uninsured in America, and there are some very powerful ideas we heard from the medical leaders today. Then let's move on and let's do that one right before we go further. Secondly, let's focus on affordability, both lawsuit reform, reasonable lawsuit reform, as well as lowering all this red tape and bureaucracy that's really squeezed so much out of our patient care in America. And I think probably what we heard from our leaders as well is we probably could take a full year to focus on the issue of efficiency, on aligning doctors and patients and hospital providers all toward that patient, of finding ways to get consumers back into the healthcare purchasing, pulling back that mystery of pricing on medicine in America, and again, bringing competition both through healthcare providers and to the buyers of healthcare, which we don't have today. And I think it's an important part of reforming insurance in America. With that, why don't I stop? I know there are questions about what happens after Labor Day. What are the crystal balls? Why don't we just stop, Pete, at this point and take questions?
Congressman, the President has signaled his willingness to compromise. Is there any hope of some big bipartisan consensus at this point?
I think there is hope for that, but the President really hasn't engaged much on the specifics of the legislation. And I think in some ways he's probably made it harder for both parties to work together. I think he's got an opportunity by blaming one party over another, not really sitting down with us to come through with those ideas. I think he could reverse that And I think the first thing he could do is announce this weekend that this bill the American public isn't buying this bill. It's time to go back to the drawing board. And let's take it step by step. And as he said during the campaign, neither party has a monopoly on all the good ideas. We certainly don't. But there's some great ideas on how we would improve healthcare in America. And Republicans are anxious to sit down with them and start working together on it.
You say this could take a year. Do you actually think that you could spend that time on this? I mean, next year's an election year. The last time this came up, it didn't come up again for 17 years. I mean, what is the likely future of this?
Well, I mean, to me, the short answer to that question is we just spend whatever time is necessary to get it right. I mean, as Kevin alluded to, this is a bipartisan issue. Both parties recognize there are problems in our current healthcare system. We need to improve its affordability, accessibility, and we need to make sure that every American has access to quality healthcare. But what's been lacking so far in the debate, at least on the House side, is that bipartisan effort. There's the president reaching out to us. I mean, we've been sitting on the sidelines largely and gathering our information by going home over the recess here and sitting down with our constituents, meetings like this here at the medical center. And I would welcome an opportunity to participate in an extended debate, again, to take the time to get this right, because it's just too important for our country's future.
Which bill do either of you see yourselves voting for? I think it's clear what problem you have, but is there a bill out there that you vote for?
You know, there are 4 that have been developed by Republican members of Congress that I think would be a good basis for that. One of the messages I'm taking back home is that Republicans need to sit down and offer one, I think, simple, powerful proposal that we can offer to the Democrats. And again, healthcare is so complex. I think one of the reasons the current bill is collapsing is because it tries to do too much and too thinly in some ways. I think if we took a more thoughtful approach, just like you don't just plop a bridge down in a road, you lay the foundation, you put the bricks and mortar together, you lay the bridge across it. If we started with coverage, then moved on to affordability and efficiency in that order, I think we could, at the end of the day, whether it's a year from now or 3 years from now, have a vastly improved healthcare system in America that both parties, frankly, would be claiming credit for improving.
And if you successfully slow this down, whether it be another couple months or that full year, isn't that somewhat of a victory for you?
No, our goal isn't to slow it down. Ours is to have quality healthcare in America, period. And rushing it through the way it's occurring today, I think is actually aggravating the problem. I think it's an obstacle to reform. Again, the American public wants a bill that improves health care significantly, not just for them, but the long term. They're not being sold, they're not buying what's being offered to them right now. Let's go back to the drawing board.
So you see no urgency to get it done by the end of the year?
Well, I'd love to see coverage. You know, I think if we started with coverage, and by the way, fixing Medicare first would be my top priority, but beyond that, I think if we focused on coverage, especially those for small businesses, people in between jobs, and those with pre-existing illnesses, we could have some significant reforms by the end of the year, and that'd be an awfully good foundation to build from. Pete?
Did you invite any of your Democratic colleagues to this meeting? So
We didn't, no. The Republican delegation wanted to meet with them, mainly because I think during this recess, it has been a bit more partisan than most would like. This gave us an opportunity to just, again, have our medical community very open to expressing their views on this, so that we just wanted a good format.
Basically, we want to keep the politics out of that room then and just talk about the issues. Oh, no, sir.
Keep the politics out of the room. There's only one flavor of politicians
just
in the
the
room.
partisan politics. Let me put it that way. Some of the issues that come up when we get together as two parties, I mean, we tend to focus on some of the things that are not important. And that was a meeting to get information, to sit down and hear their perspective, points of view in an unscripted and just an open manner. And, you know, again, sometimes, unfortunately, that gets impacted by bringing both parties together. So that's why we had just the one party today.
Can you give us a list of who all was in there?
Yeah, I'm sure we can, Tracy. You bet. We'd be glad to go through it right now.
what was the discussion like in there? What was the main topic or the most polarizing issue that you think is coming out of all this?
Well, I just think there is what we heard was a general and genuine concern that Congress is rushing through a bill that won't, at the end of the day, make health care more affordable or higher quality. And that was seen to be an overriding theme. And then going through that, what were the good ideas? And we heard so many good ideas on improving health care. I wish all of Congress could have been in that room because it was really enlightening. If we took some of these approaches and did it right, well, I think the public would be thrilled with the outcome.
I mean, again, the message I got from that meeting was take your time. Take your time to get this right. It's too important for our country's future. It affects every American, again, on a very, very personal level. The emotions I've seen at my town halls have been unprecedented. And their message was take your time, get this right. And I hope when we get back to Washington next week, we'll do that. I hope that'll start with the President's speech, the joint session on Tuesday.
You know, we heard the same message after the Hutchinson press conference a month ago, and Garnet Coleman criticized it, among others, as slow down as means kill, kill, kill. Was there anything different about this one?
Well, you know, I think lawmakers ought to be listening to our medical leaders, not telling them to take it or leave it, or passing it with you or without you. I think that's exactly the wrong approach. I think we did, again, more listening, more collaboration. We would come out with more reform sooner than the route. Right now, I think one of the reasons there is a problem with this bill, major problems, is exactly that sort of take it or leave it mentality. Healthcare is too complex, we ought to recognize it.
Can't add to that.
Thank you very much, and if you'd like, Tracy's got a list of folks who are here we'd be glad to share with you. Thanks.